All right, awesome. So I'm here today with Dr. Parul, and we are just going to have a nice conversation about the work that she's doing. How are you today?
Thank you. And thanks for having me on, Kevin.
You're welcome. We were talking the other day about how I was thinking about guests, and your name came to mind early in the morning when I was just waking up. And I can't help but feel like it's a little bit of intervention from the universe that it wants to share your message and your story and your brother's story. So, I would love for you to share with everyone a little background about yourself and what you've gone through, um, all
Yeah.
that.
Well, thanks. And, ever since, which I'll go into the story of my brother and my family, I have more and more believed in the power of the universe and how things that may not seem to align eventually do. And you realize that you're really not alone navigating the world. There are external forces that we may not be able to see and sense because we're limited to our senses,
Mm.
but there is something more beyond us. And there's a comfort, a sense of like knowing that, and there's a comfort in knowing that. And so when you approached me and you said, "Oh, you had this, you know, feeling that you needed to get in touch with me," and I truly believe that there was a power to it. Um, and ever since more after I lost my baby brother, Manu, I'm a dentist and by profession, and happy doing my dentistry thing. And in 2019, my brother was diagnosed with oral cancer, and he was a dentist himself, and almost 8 years younger than me. So I graduated dental school, he graduated high school, and then he decided he's going to do dentistry too and
Mm.
follow in my footsteps.
Oh.
So, I've watched him grow up in front of me, take baby steps, changed his diapers, have him color my notebooks. And life just came around in such a way that he was diagnosed with oral cancer just shy of his 33rd birthday. Around his 33rd birthday, he had the lesion, but by the time he was diagnosed, he had just celebrated. And within a year and a half of diagnosis, he passed away. And
Mhm.
in the last few stages of life, he wrote a series of blogs and he talks about having this inner peace and finding comfort in knowing that even though time isn't, well, he knew time wasn't allotted to him, but he never lost hope and he kept fighting. But at the same time, resigned to whatever the future may unfold, and it will as it should, and not fighting
Mm.
it.
Yeah.
So, yeah. And since his death, I've just been advocating for more earlier diagnosis because he was 34 at time of death. And this is something that's preventable with earlier diagnosis, earlier, more conservative treatment, and more prognosis of a longer life. And so it's just advocating more for earlier diagnosis, more vigilant in our screenings as dental professionals, paying more mind and paying more attention to our bodies, knowing when something is wrong, getting help sooner. And
Hmm.
um, and I couldn't save him as a dentist, as an older sister, as a daughter. Um, so I'm hoping that my story, and with awareness, we can save more lives.
Yeah. And I'm sure that it will. I'm sure it
Yeah.
will. A lot of questions come to mind. My first is for, like, I'm curious about dentists. So I'm curious about some of the aspects of your experience as going through all this, and how it's changed your life. But I'm also curious about dentists. Like, do you have any practical advice for them or any information, like resources about oral cancer that you
Sure.
want people to know about?
Yeah. I mean, oral cancer is the sixth most common cause of cancer right now worldwide. And the case is
Wow.
increasing. And the reason is, yes, your traditional risk factors like smoking and drinking, vaping, that's big, especially in the young. Um, our youngs are starting to vape much more sooner than smoking was because it's more
Mm.
socially acceptable. Kids in high school are doing it. Um, but also the HPV, which is the human papillomavirus, and we can prevent it by getting a vaccine.
Hmm.
So getting that more awareness, like this is the same virus that causes cervical cancer, and those cases are decreasing because there's a pap smear and you can test for it. But with oral cancer, there is no urine test or blood test or some kind of diagnosis unless you see a lesion. And so for dental professionals, it's that when a patient books an appointment with you, they've picked you for a reason, whether it was from a Google ad or a Google review or your friends and family, or you took their insurance or you were in their walking distance, whatever. They picked you for a reason. And so you, as a healthcare professional, owe it to doing a full comprehensive exam on them. And it doesn't take a lot of time, and it's no like fancy device you have to bring to the table.
Hmm.
It's palpation, it's checking, it's asking the right questions. It's educating your patients about, hey, you shouldn't be smoking. Um, if you have cancer history, do you know that if you've had other forms of cancer, it can metastasize to the oral, like having that awareness and being able to help your patient
Hmm.
and screen for 2 minutes. And if you see something, whether the patient is aware of it or not, whether it's painful or not, but you see something and it hasn't healed within 2 weeks, you do a biopsy. And do not, and from my own personal experience, like Manu saw a lesion and it wasn't biopsied and he was put on prednisone by a neurosurgeon without having a diagnosis. How can we treat
Hmm.
patients without knowing what we're treating? Is it a fungal infection? Is it a bacterial, viral? Is it traumatic? I mean, what are we healing
Yeah.
for? So know what you're
Do the biopsy.
right. And it doesn't have to be a scary word. It's how you word it to your patients. Like, I see something that I don't like. Let's just get it checked out to make sure
Yeah.
that you're okay before it's too late, you know? So it's just being more mindful of the patient that's in your chair.
Yeah. That's helpful to have that example of the language to use because, I think a lot of dentists are busy, they're
Mhm.
stressed, they're overwhelmed, and maybe don't want to always mention something that's going to make someone nervous or uncomfortable, especially if the patient seems low risk.
Right. Right. Which 30-year-old wants to hear they have cancer? They're younger and younger
Yeah.
people being diagnosed. But I don't know if you're aware of this. I mean, as that the number one cause of dentists getting sued is perio. The number two cause is failure to diagnose cancer, oral cancer.
Mm. Wow. No, I've never heard that statistic.
No, yeah.
Wow.
So if you're watching a lesion, like you wouldn't watch a cavity, you want to treat a cavity before it becomes a root canal, before it breaks down, before you lose the tooth. A tooth is
Hmm.
replaceable. We can put an implant, we can put a bridge, we can do a denture. We know how to do that. But what happens if you do a late diagnosis and the patient ends up losing life? How do you replace
Yeah.
that? There's no price for that.
How long did your brother go before he got a diagnosis?
Months.
Months.
Uh, I live in New York and he lived in Canada in Calgary, which is other coast. So I would see him, summers or here in winter. But he showed me a lesion in June and he said, this is kind of painful. And later on, I found out from friends that he was not feeling his best and something was irritating back even as in March. And
Mm.
he told me about it in June. And I told him, I'm like, this looks suspicious for cancer. I've showed it to my surgeon's friends. And he's like, I can't have cancer. There's denial
Mm.
of that.
Mm.
Like I
Yeah,
said,
even as a dentist, he couldn't
yeah,
face that.
he's like, I'm a
Yeah.
dentist. I'm healthy. I mean, he played rugby. He was a provincial champion. He played squash. You couldn't beat him on the court. He loved to dance. He was kayaking, golfing. I mean, he was active as it can get. And he's like, I can't have cancer. Nonsense. And I'm like,
Yeah.
okay. And by the time I was diagnosed, yeah, it was already stage 2 in his lymph nodes.
Mm. Yeah. I found that interesting that you said that oral cancer is on the rise, but I would think that it would be decreasing with the HPV vaccine.
I think there are not enough people that are getting vaccinated. We know with COVID how people love vaccines, but
Yeah.
there, I don't think enough people are getting vaccinated for the HPV, and that's why it's been increasing.
Hmm.
Um, and there's not enough awareness for it. And
Yeah.
HPV, you want to get the kids vaccinated when they're young. And the
Yeah.
other population that isn't getting the HPV vaccine are the older generation who are in retirement homes
Hmm.
who haven't got the vaccine. And, there used to be Gardasil 4, which protected against 4 different strains. Now there's Gardasil 9, which protects you from 9, HPV 16 and 18 being the ones that cause oral cancer. So, there is more now a broad range. So even if you've had it at 4 and you've had it at 9, you're still not protected enough. So it's
Hmm.
the older population not getting it, and young parents are not vaccinating their kids. I mean, there are parents who
Yeah.
don't vaccine for measles. How are we getting
Yeah.
them to do it for HPV, right? So it's all about education for patient awareness. Yeah,
Hmm. And like you said, it's going to vaccinate them against several different HPV strands. So in that case, it makes sense for someone to get it even if they have HPV already, right?
correct. Is that too loud?
I can't hear anything.
Oh, good. Okay, excellent. Sorry.
Yeah.
Okay, great. Yes, absolutely. So the thing about HPV is that once you're infected, it stays in our bodies. Um, 80% of us at some point have contracted it.
Hmm.
Now the body gets rid of it within a year or two, but for some reason it can lie dormant, and then why it becomes cancer, we don't know. Whether it is a genetic issue, whether there's some contributing factor to it, why it becomes from just being dormant to being active into oral cancer, we don't know. So even if you've contracted HPV, you can still get the vaccine. It won't protect you from an already infected virus, but it'll protect you from contracting a new strain. That
Yeah, which is why it makes sense for elderly and
Yes,
anyone that's still sexually active to be getting it.
correct.
Yeah. Yeah.
Yeah.
Um, at one point, I was looking into all the different devices that exist. Do you have any take on those? There's different screening devices that dentists can purchase and use in office. Do you feel like that's more effective?
Honestly, tactile sense and visual are the best. The devices help you screen. And when you're palpating and you're feeling for the nodes, that's not something that you can diagnose with a light. Yes, you can pick up
Hmm.
lesions that are, the way the light works is that if there is some abnormal growth, the light doesn't reflect back. And so it's not fluorescent anymore. It'll be dark. So there are many different types of lights that are out there.
Hmm.
Valscope being one of them. So they're great screening devices, but again, they're just screening. And when we're doing our tactile and we're actually having them open their mouth, stick their tongue out, feel, look in their tonsillar area, the palpate, the papillary glands, everything. We're looking underneath the tongue. We're feeling for any nodes, any especially unilateral nodes, anything that is kind of like hard and like not moving, like firm. Um, those are the kind of the best ways. And again, we're telling our patients we're just screening. And
Hmm.
even if you say like, yes, I saw a dark lesion on your palate, perhaps, or on the soft palate, I see a suspicious lesion, we're just going to get it off for a biopsy. And
Yeah.
that's truly detected. So yes, it's a great adjunct. Is it necessary? No. Should you be always
Hmm.
screening? Yes. Um,
Beautiful.
yeah. I had a patient come in yesterday and he's like, oh, I can't, it hurts to swallow my tongue, that, he's touching here. And of course, the first thing I'm thinking, of course, is cancer, right? Those are one of the signs: unilateral pain, hard to swallow, all of that thing. And then when I started asking him questions, I'm like, okay, when did it start? I just started on Sunday. I never saw anything before. I don't know why. I've had an infection. I may have an infection. And I look in there and I saw a broken tooth. And I'm like, when did this break? He's like, oh, my crown came off, on Sunday. And that's when the pain started. So it's putting those pieces together, not
Yeah.
everything should jump to oral cancer, but really you play detective. Like, okay,
Yeah.
broken, let's smooth it out. Let's get you back in 2 weeks. If it hasn't resolved, then let's get in for a biopsy. But right now you're okay. So yeah,
Yeah. I
it's
love that. That's
absolutely
funny. Yeah, and good. All those pieces. Do you happen to know what the earliest is that someone can get oral cancer? Because as an orthodontist, a lot of orthodontists don't screen for oral cancer. And I do remember, a friend from high school, I think she died in her 20s from it.
yes.
Um, so do you have a particular age or range where, or just pretty much everyone we should be screening?
Pretty much
Yeah.
everyone. I think there are people in their teens that have been diagnosed, but yes, 20-year-olds. And the younger population that's being diagnosed is actually the ones that are going to be dying. Like that cancer
Hmm.
is more aggressive than somebody who's older.
Yeah.
It's definitely more aggressive in the younger population.
When it's an HPV related, right? Versus like an
When
alcohol
it's
related.
when it's any sort of cancer, but
Mm,
oral cancer. So oral cancer is really divided into two categories. It's the oral cavity cancer, which is your front of the mouth, anything
mhm,
from the anterior 2/3 and front, from the lip to the back, the anterior 2/3 and the hard palate. And then from the soft palate and towards the back, more posterior is the oropharyngeal cancers. And those are your HPV related cancers. So your oral
mm,
cavity cancers is like sun exposure, you get cancer on your lips, basal cell carcinomas, squamous cell carcinomas, or from your traditional smoking, drinking, vaping. There's a product out called Zyn. I don't know if you were aware of it. It just
mm-mm,
actually got recalled. It's a Swedish, it's chewless tobacco, or it's actually tobacco that you put in the mouth and you leave it in there,
mhm.
the side of your cheek. And a lot of the young kids and baseball teams are doing it. It just got recalled off because of how carcinogenic and cariogenic it is. It's not good.
Wow.
And
Yeah.
and these are things that are more socially acceptable, because you have now a group that's using it. The team is using it. There's no smell, or you're
Yeah.
not shunned to the smoking area in a different, so social aspects play a role to this too. Yeah. Um,
Yeah. And I was just
so
going to say, even in my orthodontics, like, I would look in some kids' mouths and I would see, um, the beginnings of pathology from using dip and tobacco. And it was so quick, they were young, they were 14 and they were getting
yes.
massive gum recession, a different appearance of the tissue, that leathery look. It's really fast, some of the
It's
changes.
And with ortho, if they've got traditional braces on, poor perio is
Mhm.
an issue anyways, and then you combine it with these
Yeah.
cariogenic factors, it's just going to destroy health.
Yeah.
And you don't realize the consequences of until sometimes it's too late. Yeah.
Yeah, absolutely. Oh. Um, I'm curious how all of this with your brother changed your life and, the trajectory of your work or the different things that you're doing now. Um, yeah, do you want to share any about that?
Sure. So, I think I mentioned this before. I was happy doing my little happy dentist in my little office, where nobody knew me except for my patients, my staff, and my little bubble. And when I lost money, it was time of COVID. I lost him in 2021. I could not make it in time because of border closure. I had the compassion release
Mm,
from the government, but I needed a 3-day PCR test. And while I was trying to expedite that, I had to tell him to let go, that don't wait for me.
mm,
He was on a morphine drip. And I spoke to him like I'm speaking to you right now. And I'm scrambling. It's Sunday. I'm trying to book a flight. My PCP is on a Sunday trying to get my lab results expedited. Like there's a whole lot of commotion and noise, untraditional to, tragedy. it's like tragedy on steroids.
Hmm.
And I told Manu, I'm like, you're done. If you need to go, it's okay. Let go. And I think it gave him permission to do so. And it was very quick because Friday he went into the hospital with leg swelling. He had a pulmonary embolism. Saturday he was admitted to hospice. And Sunday, within a few hours of me telling him to let go, he passed away in the evening. And so I knew going, I was planning a funeral. And I don't know how many people know about this, about me and Manu. We grew up in different countries, 5 different countries for me, 4 for Manu. I
Mm.
was born in India and we moved to the Middle East when I was like 5 or 6 years old. And Manu was born there in the Middle East. So we grew up, our childhood is there. And then I moved to the US for school, for undergrad and dental school. And Manu migrated to Canada with my parents in his teens. And then I moved back to Canada, worked there before I got married and moved. So in essence, we did not have a global, sorry, we didn't have a village to protect us, a village of people we grew up with, our friends from childhood, our cousins, uncles, aunts, any of that,
Mm.
or family and supportive friends. It's either people who knew me in different phases of my life. And so losing Manu was compounded with not having a village of grief, protecting me
Mm.
from the grief of it all. And losing a sibling is very unique because my parents lost a child, but they had each other. They were
Yeah.
going through the same, they may be grieving separately in their own ways, but they're grieving collectively as the same loss, a child. I lost Manu, who was supposed to outlive me, who was supposed to tell my stories at my funeral to my children. I got stripped of an identity from being an older sibling to an only child. I got denied things that I had taken for granted, more family, being an aunt, planning a wedding, my kids having cousins. Like this whole element of the future that I was certain I would achieve or I was entitled to was taken by no fault of my own. And it was very hard to put the blame on anyone. It's no one's fault. It happened. And so it was coming to that realization that, especially as dentists, we're so type A, like we have to control everything.
Mm. Yes.
that, that let go. Um, and then the future will fold as it should, whether it makes sense at that time or it doesn't. And I still don't know why him. I'll never have these answers,
Yeah.
but it's finding the right people. It's changing my priorities. It's changed the way I look at life. Um, and another factor is that I realized my most precious commodity is time. Money comes and goes, people come and go. We can make plans, we can do stuff, but we cannot replace time.
Yeah.
And we're not told how much time we're given with a certain someone. We're only allotted. And so to really be wise how and with whom you spend it with.
Yeah. It's beautiful.
So I've learned to
Beautiful.
say no to things that don't bring me joy, that
Mm.
I don't feel good about being in that space or being in front of that person or that environment, that if I'm not happy, I am not going to do it. And it shouldn't be out of obligation. It should be because I want to.
Hmm.
So
I love that. I love those tangible pieces that we learn as we go through life that, make our lives better. And so that sounds like you really established boundaries Have you
Yeah,
done anything else in order to, do you have
I
any like practices towards gratitude or presence? And you can keep going too if you had another thought on that.
not gratitude. Sometimes with stuff like this, it takes a little while to do gratitude, but it helps
Hmm.
to remember the good because, like my husband, who's been a huge supporter, um, had he not been, I would not be with him at this point because grief takes a toll uh, on your relationships.
Yeah.
You still have to play the roles of life. You still have to do things, and life goes on. It doesn't stop. His life got interrupted, but the world didn't stop. It kept moving. And there were so many times I would be like, just stop, let me get off, let me process, and then get back on. I'm not ready. I'm not ready. And so I started doing a lot more meditation. I did, and I think I found my comfort or my healing in the concept of the universe rather than a God, because, you know, I'm not preaching or anything. I'm not very religious, but, I've always believed, like most people, that God is, you do good, good things happen. It protects you. Like, I
Hmm.
couldn't, there was an anger issue, like, why would you do this? What did we do wrong?
Right.
Us, why not? That whole processing of like, why me? Why did you do this to me? And it's trying to shift the blame on something. And so I walked away from that concept of that self-pity,
Mhm.
but trying to meditate, clear my mind, focus on the concept of energy, because energy isn't created or destroyed. It's really transferred. We've learned that, right? Newton's law somewhere. Sixth grade science.
Yep.
So Manu's energy, I mean, when I saw his body, I was like, that's not my brother. That's not him. He was long gone. And you can sense energy. And you know that when you've in the presence of someone, right? When you're like, oh, that guy's a creep because they are warding off some vibes. And when you feel just good sitting next to a person, whether you have a great conversation or you don't, you just feel good in that presence because there's a sense of energy. And so focusing on that has given me some sort of peace
Hmm.
and resilience and a way to move forward than just being like, this sucks. Why me? This is the worst thing that can happen. But, finding some sort of a purpose um, to it all. It can't be in vain.
Yeah, I
Yeah.
love that. And it continues to unfold.
Yeah. It continues to unfold.
Yeah.
You just keep doing your part.
And don't you have, do you have a symposium now that you're starting?
Yeah. So when Manu was going through the treatment, there were so many questions that I had. Even though I was a dentist, Manu was a dentist, but when Manu had a surgery, he had half his tongue resected. He had a neck dissection. He had a trach. He had a team of vascular plastics, oral surgeons, ENTs in there. And with the healing, speech therapy was needed. Oral cancer patients had the highest suicide rates because these patients are
Mm.
missing sometimes half their face. They don't have teeth. They're not able to do certain things. Like you'll see a lot of other types of cancers. Patients are living normal lives, breast cancer, testicular cancer, prostate cancer. They were out and about. But with oral cancer, and if you're not able to eat properly, you may not want to be in a restaurant because
Yeah.
food's drooling. You can't chew. You have appliances. And so those little joys of life of spending a meal with your loved one is denied. And there's a lot of emotional anxiety. Um,
So,
but there were all these questions with a whole different range of factors, wound care, and with radiation burns and so on and so forth. So I created what's called the Do a Good Job Symposium, which I wanted to give oral cancer a 3D look. What it is, how do you diagnose it? How do you screen your patients? And then what happens? How do you give them home care? What do you do with dry mouth? What if they can't open their mouths? What are the oral systemic links? What is a viewpoint of a surgeon?
Mm.
How do you do wound care at home? How do you do an estate planning before you're diagnosed? Kind of have your things in order prior. How do you deal with emotional aspects of whether you're as a provider delivering horrible news, or you're the one who is going through it yourself, or have a loved one who's going through it? How do you deal with them? And you're empathetic as a provider, because we forget, right? We're, like you said, we're busy. We're a dentist. We have all these patients to see. And in ortho, you're seeing maybe 100 patients a day sometimes, right? And you're
Mm.
quick.
Yes, it's a lot. Yeah.
It's a lot. And so and sometimes you're drained, you're mentally drained, you're physically drained, you're just emotionally drained. And you have to replenish that as a provider so you can show up the next day and help someone.
Mhm. So is your symposium for providers
For
or
all
the
healthcare,
general public?
yeah, for all
Okay.
healthcare providers, CEs are awarded to for dentals. But
Mhm.
if you're a healthcare professional, whether you're a survivor, because I have survivors speaking on there who are oral cancer survivors. I have talks on nutrition, what things are good to eat, what are not good to eat, and how to persevere after cancer. We've all made mistakes in our lives, and not to let mistakes, whether it was a late diagnosis, whether whatever challenges we've had in our life, to not let those define us, but how we arise from there. What if you can't practice your profession? So there's so much more to cancer. It deserves more. And linking oral, the dental space with a medical space. Because as medical professionals, you just send your patients off to surgery. But guess what? Before they go for their chemo radiation, they need to get stuff taken care of with their teeth, because they're going to have other issues. They're going to have radiation burns if you have a silver filling. They need fluoride
Yeah.
trays. There's so much more to it. And so this symposium encompasses all of that. And yes, it's live on the 27th, which would have been July 27th of this month, June, which would be Manu's 38th birthday. And
Oh,
recordings are available till the end of the year. And
beautiful.
I'm hoping to do it in person. But as part of the symposium, in the swag bag, you get the book.
Beautiful. I read
Yeah,
the book, but it's been a while. I want to go back now and reread it.
yeah,
Yeah. That sounds like a really fantastic symposium. I didn't know what it was going to be about exactly when I saw that it was posted, but all of
yeah.
that makes sense. And yeah, in dental school, you don't get a lot of education. You get an overview, but not the nitty-gritty details that you'd be going through with a patient.
Yeah, nitty gritty. And like I have a dermatologist on there who's talking about wound care on there. Um, but you don't,
Yeah.
and it's not in our field, it's not in our zone. And this likewise, the same way, medical professions don't get a lot of details about oral cancer. Patients with like the diet of oral cancer, here are my patients, hear the story or whatever. And they're like, we never knew that. What? You're like
Yeah.
blown away. Patients don't know that.
I don't know.
And so, when you're screening your patients and you're like palpating and having them stick their tongue out, and it's pretty invasive sometimes, and you're already in their personal space to begin with, and you're not the most loved profession to begin with, so all
Yeah. They're
so
already scared
the
to be
dentist,
there.
and you're right up there and in their face, and with all these
Yeah.
sharp instruments coming at them, so you're already in an uncomfortable, and then you're like, oh, turn here, and I'm gonna palpate here, and I'm gonna feel under your on the floor of your mouth and lift your tongue. So you're doing all this, and it's pretty invasive. You got to tell your patient, this is what I'm doing, this is why I'm doing. And if they have it done in past by another dentist and they've come to you and you don't tell them that they're doing, they may think you're not competent. that you missed a whole oral cancer screening. You're doing period charting, you're showing them, you may do a scan and you talk about airway, you may talk about, oh, you've got crowding, maybe we should do ortho. So you're talking about all these other things. So you're doing a comprehensive exam. Oral cancer is the same thing. It's part of that, you know? And
Yeah.
I think it gets missed because there's no special code for it. There is, but insurances don't pay for it. So it's not a big
Mm,
ROI on it. Like, oh, it's going to
yeah.
make you X amount of dollars. But really, the ROI is saving a life, and there's no bigger ROI than that.
I completely agree. Yeah, I think it's maybe no code and just the stigma that, young healthy don't get it, even though we know that it's on the rise. Even
Yeah,
when I go for my appointments, I'm always asking them, "Hey, did you do an oral cancer screening? Can you make sure,
right, right. That you're doing
yeah,
it. Yeah.
yeah, yeah, because they don't discuss it or tell you, oh, it's clear." I'm like, I don't know if they did it or not.
Yeah, yeah, you're clear, but also like, hey, if you notice something, like make sure you come back and tell me about it. Don't wait too long. Don't wait
Yes,
till the next six
educating your
months.
patients.
Right. Don't wait for the next 6 months. Come back and
I feel
see.
like a lot of this conversation, if patients are listening to it, it's stuff that they can also look for at home in between
Correct.
visits, just
Yeah.
like you might do a breast exam, you could just do a quick look every once in a while and make sure everything's
Yeah.
clear.
In my swag, I actually have some stuff here ready because I've got stuff going on for the symposium. But in my swag bag that you brought up, I have, this is called the 6-step screening process. It's done by a oral cancer survivor. She's a 24-year survivor. I don't know if you can see that, but it's a
Kind of
self,
going in and out. Cool.
yeah, because of the, it's an oral cancer screening card, how you can kind of screen at home, just like you would for a breast exam,
Perfect.
and know what you're looking for. So that, that comes along with the swag stuff.
Oh, beautiful, beautiful.
Yeah.
Well, I love everything you're doing. Yeah, so many good pearls here for dentists to just really pay attention to do the screening exams, to look, to palpate, check the lymph nodes, and biopsy. And you included all that beautiful communication that they can give the patient as they're describing it in a gentle way. We're just looking out,
Right.
you
We're just
know.
looking out. You don't have to scare your patients. And one of the other things I'd like to point out is that if you, as a dentist or as a specialist, are able to do some of the surgeries, like if you're doing surgical extractions, you're placing implants, learn to do a biopsy. Do it at your office, because
Mm,
life is always happening. Patients don't like that word. Nobody
mhm.
wants to go, like, they may have a trust factor with you as their dentist, as their family dentist. Their whole family may be coming to you. They've been seeing you for years. They know you, they feel comfortable with you. They may not feel comfortable to go to a specialist that they don't know and fearing that word biopsy.
It's
So if you
scary.
see, it is scary. And it's
Yeah.
like, oh, I'll wait till my vacation is done. I'll wait till, I've got my kids christening this weekend. I'll wait till after that. I'll wait till school starts. When the kids are busy, I don't want them to be worried about it. There's always a reason to delay it. And the longer we delay it, the worse the prognosis. So if the patient's in your chair and you see something on the side of the tongue, just take a small snippet of it. There are pathology labs out there, and I have a pathologist who's speaking at the conference. She'll send you a free kit, send it off, ship it off to her,
Mm,
and the medical insurance covers it. You know,
it's
um,
awesome.
learn to do it. If you can take out a big giant tooth, you can take out a small tissue sample and put a stitch in there and get it done. Obviously, just like what things you cannot do, like if it's an extraction by the nerve and you're risking nerve damage, you're going to send it to the oral surgeon. Sure enough, if there's a lesion on the soft palate, you don't do that. You send that to the surgeon. But just like that, know your limits. But if you
Yeah.
can, let's skip another step, because that's another fallback that patients don't. They get missed through the cracks, and then they come a year later, and now you're like, are you kidding me? Why
I
do we?
could see that though. That's a great point because Yeah,
Yeah.
I mean, I've been to appointments and the doctor's just done it really quick, whatever the
Yeah.
biopsy was, a thing on my skin. But
Yeah.
I think if I had been told, oh, come back and schedule it, like you could get anxious, you could forget. I could see a dentist maybe being concerned that if they haven't been doing biopsies, that they wouldn't get the right area or they would be held liable, but they would miss something. Is there good education for them or is it just a
There
matter of just taking samples
taking
from
some
different
photos.
places?
Right. And so it's knowing where to take the tissue sample from. Like the redder areas are more aggressive, like the cancer is worse in those areas than the white area. So if you see a mixed
Okay.
lesion, you want to go try to get the redder area. Um, and you want to get a little bit of the normal tissue so you have some comparison to it.
Hmm.
And there are courses out there that you can go and learn how to do a biopsy.
Okay.
Yeah.
Are there any that you recommend or that you
The ones
highly
that I've
regard or
seen, the ones, I mean, Dr. Ashley Clark, I mean, she's a great pathology course and, but your regular, local society, I mean, I've done the one by the Greater New York Dental Meeting. That's the big regional meeting that we have here. And I took a
yeah.
biopsy course there and we did it on, pig cadavers. And then I started doing,
Mm,
irritation fibroma on the side of the cheek. That's simple. We could get it and remove it. If you have a laser, it's even better because you can kind of excise it
mm,
with minimal bleeding. Um, and then, yeah, anytime you take out anything, even if it's a papilloma, you always want to get a biopsy to know what it is.
mhm,
And another key point I'd like to bring up is for those patient or those doctors who are doing CBCTs in their office.
mhm.
If you're doing a CBCT in your office for airway, or if you're an endodontist or for any reason, make sure you get an oral radiologist reviewing it because we're not trained to read those. There's so
Yeah.
much information in those CBCTs besides the teeth. There's so much.
Yeah. I've heard this before that you should be sending them somewhere. Everyone gets sent off and
Yeah,
read by a radiologist. Yeah.
yeah,
I'm not
unless
sure that everyone's doing that. I'm sure they're
oh,
not.
oh, yeah. I mean, build the
Yeah.
cost into that, but that includes a copy of your, because there are things that get missed because we
Yeah.
don't know. We're not trained unless you are an oral radiologist.
Hmm.
And our focus is not that, right? Our focus is like, oh, there's the MB2 canal. That's what we were looking for.
Yeah. We're looking at all
There's
the
the
other
proctor.
stuff.
Yeah, yeah. We're not looking at the pituitary gland. Like, we're
Yeah.
not. So
Yeah.
we're not looking at the carotid artery. There's a blockage, like something, anything could come up. And the patient may not have ever gone to a medical doctor because they feel they're healthy. And we know how many cases there are of young heart attacks. Um, but, it's that whole oral systemic links that everything is all, it's one body. It's not dissociated. So yeah, so
Yes.
if you're doing CBCTs, get a radiology report in.
Hmm. That's a really good point. And I love that I love all the integration, yeah, of the oral cavity with the rest of the body. We've been separated for so long in
Oh,
dentistry, but I feel like
yeah,
it's coming back together. And it sounds like
yes,
your symposium is doing that as well, just bringing
yes.
all the providers together, the knowledge,
Yeah.
integrating it.
And it's a whole range of doctors and specialists who are speaking on there, from physical therapy, dermatology, psychologists, your oral surgeons, oral pathologists, hygienists, dentists, we're all in this together.
Hmm.
And a cancer is not just like, oh, you have oral cancer. Oh, go to the surgeon and be done with it. It really, it affects everybody in some way or form. And it's to bring awareness to all. And I hope that the symposium kind of helps bridge that gap, answer those questions, create a network, a village, where you
Yeah.
can find answers. Who do you talk to? Yeah. to find those answers.
I'm excited about it. It sounds amazing.
Yeah.
How
Yeah.
can someone find out about it if they want to listen in?
Sure. So it's at DUA, good job, .com. So Dua is my maiden name, and of course my brother's last name. So it's a pun off our word of our name. And
I
so
love it.
yeah, so it's very simple. DUA, good job. For dental professionals, there is CEs for them, and they can watch recordings till the end of the December of this year. There's a swag. So we have some fun stuff, including the book. And also there's some raffles. So we have companies like Stella Life, which has amazing products for oral stomach
Mm,
health. They have wonderful products for healing, whether it's cancer or whether it's even like post surgery, implant surgery, or you've had all on X, anything. Um, Even sores from braces. So their products, there's and
cool.
Sipify, which is a straw uniquely for people who, after bleaching, you don't want to be drinking normally, right? With it stains your teeth, so you don't want to do coffee. And there's hot coffee you can't drink really from a straw, so that helps. And it's great for people who have Parkinson's or other disabilities. And yeah, electronic toothbrushes from Zana. So yeah,
Cool.
lots of raffles, lots of goodies, and
So fun.
yeah, so I'm excited.
And I'm
Yeah,
so proud of you for putting that on.
thank you.
You've really done so much in this field since your brother's death, and it's beautiful work. I know you're doing a lot of good for the world.
Thank you. Yeah, I couldn't save him, but his death couldn't be just another statistic. Like, here's another cancer death and a
Yeah.
check off for cancer, it had to have more meaning to that. And I feel like in an essence, he's kind of helping me along the way.
Hmm.
Because he gave me the writings of the book. He actually told me I want to be published. And I said, okay, you keep writing. He wasn't married. He was single. My parents would come and help him. And friends' contact was limited due to COVID. So writing was his outlet. I'm like, keep writing. And he really
Mm,
wanted to see himself published and he couldn't. So I was like, the one thing that I could do for him, I couldn't save him.
yeah.
Didn't get him an earlier diagnosis. Let me get him in print. And then, yeah, and he allowed me to share in the sense he was very vocal about sharing his own story from the diagnosis he shared in
Yeah.
2019. And then he shared about leaving dentistry. So I knew he had given me a permission. It wasn't that I took the story from him. He already had it out there. I just carried the conversation.
Yeah. Beautiful. And I'm sure that he loved knowing that you were helping him with that, even though he couldn't see it through.
Yeah. And he gives me little
Mhm.
signs.
Well, I was going to say, it kind of goes back to our energy thing in the beginning. I feel like his energy is maybe channeling and
Yeah.
helping give you the courage and the strength and the energy to do all of this that you're
Yeah.
doing.
Oh yeah. Lots of signs that are just unbelievable that I've
Oh, I want to hear about this sometime.
yeah, yeah, yeah. Yeah, for sure. For sure.
Beautiful.
Yeah. I know the time, but one of the biggest signs that I got was we had planned a trip. I'm trying to make this as short as possible. But after Manu's initial surgery in 2020, we had planned a trip to go to Hawaii, to Maui, as a family to celebrate his first
Hmm.
cancer surgery. We are like, okay, he's beaten cancer. We're good. Dad's turning 70, mom's turning 65. We planned this whole trip. But COVID happened, trip got canceled. He had cancer reappear and he passed. So after the travel restrictions lifted, I said, I'm going to go on that trip that I planned with him. And everywhere I saw little signs, but he always talked about renting a Jeep. So we rented a Jeep and we drove to the road to Hana in Maui, which if you've been or people have seen, it's
Long
a
time ago, yeah, I don't
yeah,
know.
it's a beautiful ride. It's, the ocean on one side and you have the cliffs and it's Some spaces, it's just one-way
Mm.
street. And we get to Hannah, and then it's all cobblestone, like it's all unpaved. And my husband's like, let's go. It's a town of 1,000 people. So we're going, and I saw a house, and I said, back up. He's like, I can't back up. It's a one-way street. There's cars coming. I'm like, no, I saw something. Back up. There's nobody around us. So we backed up. And the house had a board on it. This is a town of 1,000 people in this tiny little village in the island of Maui. And it said Hale, which means house of Manu, Manu.
Mm.
And I'm like, I thought I saw something. And we took a picture.
Mm.
And I was on that trip that I planned with him. He wasn't there, but he was there in spirit. And so signs like that have always appeared.
That's a big sign.
Yeah. Hale and Manu. And I'm like, that's where
Like
you
it couldn't
are.
be more clear than that.
No, no.
Oh, thank you for sharing that. I
Yeah.
love that. Yeah, that's beautiful.
Thank
Well,
you.
thank you for coming on today. It was a pleasure talking to you, and
Likewise.
yeah, just enjoyed it so very much.
Me too. Thank you so much. Thanks for sharing the story.
Yeah, awesome. Have a good day, and we'll be in touch.
Sounds good.
Okay.